Well, I think that the process can be cumbersome, and Medical Solutions, number one, makes it easier for the practitioner. And if it's not easy, the practitioner tends not to want to do it. So that's number one, is it saves you time. It provides a better service. The service is superior to all that I've seen. And Medical Solutions will always be around if you need troubleshooting being done. Well, I think Medical Solutions had a relationship with my former partner, and then when he retired and I replaced him, they already had a foot in the door. The difference is that I've actually promoted lymphedema therapy, and so we tend to recruit a lot more patients, and they're usually patients that others have given up on. So Medical Solutions really has assisted me in providing that service within the hospital to the patients, getting pumps for patients sooner than they would normally have gotten them through the insurance process. And they're always there. One phone call away, or one email or text message, and I can get a hold of someone to fix anything that's not working right. It is. It's nice taking care of someone else's problem rather than making the problem yourself. But it's complicated, and you have to put aside immediate gratification. Some of these wounds can take months, if not years, to heal. And some we don't heal, but we can strive to prevent them from getting worse and maintain the patient's quality of life and function. Well, I'm fortunate to practice in a facility that has a congestive heart failure program. So we tend to see lots of patients in the hospital with edema in their legs. And sometimes this is on the basis of congestive heart failure. Much of the time it's not one medical entity. It can be chronic venous insufficiency or lymphedema. But the patients are there. And I spent many years as a surgeon walking from room to room, seeing these legs and having no real interest in taking care of them. Now, running a lymphedema program, I tend to focus on the patient's lymphedema. And so I have a variety of biocompression 8-chamber pumps that I will take into the hospital from my office, place them on patients, in-service the nurses, and during their inpatient stay, we will provide them with lymphedema therapy. The goal then is to make a smooth transition from inpatient to outpatient, put the paperwork through, and hopefully by the time the patient leaves the hospital and goes home, they are pre-authorized to have their own system waiting on their doorstep. And when that happens, and it's without any gaps in service, the outcome tends to be much better. Placing the devices, and usually I use the biocompression ones, on an inpatient side, it gives me a chance to see whether the patient would tolerate the treatment. Most of the time they do. Sometimes they do not tolerate the compression therapy. So it allows me to pre-select those that are going to do well outside the hospital. About 80% of the patients we see in our wound center have wounds of their lower extremities below their knees. These wounds can be traumatic wounds, they can be stasis ulcers as a result of lymphedema or chronic venous insufficiency. The cause of the wounds really doesn't make a difference. What is important is to heal these wounds. It is essential to offload the legs. You can put any type of topical wound therapy on the wounds, but if you do not control the swelling or edema, the wounds will not heal. So I generally tell my patients the more swelling, the more drainage, and the longer the healing. So with lifestyle changes such as leg elevation, fluid restriction, sometimes diuretics, you can combine compression wraps to the legs, kind of like ACE bandages, and then you add a compression pump, and you'll see you can offload the legs much quicker. Think of it as a traffic jam due to a car accident. The leg is gridlocked with fluid, and the healing elements can't get in and can't get out of the leg due to the swelling. So if you can clear some lanes of traffic, you can get the rescue vehicles to the accident site more thoroughly. So that is basically how relieving the swelling of a leg can assist in the wound's healing.